Hello everyone, and welcome back to the channel. Today, we're diving into a topic that many of you have asked about, a powerful antibiotic called ciprofloxacin. You might have heard of it, or perhaps you've even been prescribed it. But what exactly is it? How does it work? And what do you need to know to use it safely and effectively? Let's break it down together. So, what is ciprofloxacin? It's an antibiotic that belongs to a class of drugs known as fluoroquinolones. Think of it as a highly specialized soldier in the fight against bacterial infections. Its job is to stop bacteria from multiplying and spreading throughout your body, giving your immune system the upper hand to clear out the infection. It's a broad-spectrum antibiotic, which means it's effective against a wide variety of bacteria. Doctors prescribe ciprofloxacin for a whole range of bacterial infections. This includes common issues like urinary tract infections, or UTIs, which can be incredibly uncomfortable. It's also used for more serious conditions like pneumonia, certain types of infectious diarrhea, and infections of the skin, bones, and joints. Because it's so potent, it's often reserved for infections that are a bit more stubborn, or when other antibiotics might not be the best choice. It's a crucial tool in a doctor's toolkit, but it's not for every little sniffle. Remember, ciprofloxacin only works on bacteria, has absolutely no effect on viruses like the common cold or the flu. Now, for the science part. But I'll keep it simple. How does ciprofloxacin actually stop bacteria? Inside every bacterial cell, there's DNA, which is like the cell's blueprint for everything it does, including making more of itself to replicate. The bacteria needs to unwind, copy, and then reseal its DNA. This process requires special enzymes. Ciprofloxacin works by targeting and blocking two of these critical enzymes called DNA gyrase and topoisomerase. By blocking them, it essentially throws a wrench into the bacteria's replication machinery. The DNA gets tangled and damaged, the bacteria can't divide, and they ultimately die off. It's a very precise and effective mechanism that halts the infection in its tracks. Okay, let's talk about the most important part, how to take ciprofloxacin correctly. Following your doctor's and pharmacist's instructions is absolutely critical for the medicine to work and to minimize side effects. Ciprofloxacin usually comes as a tablet, and you'll typically be told to take it twice a day, roughly 12 hours apart. Try to take it at the same times each day to maintain a steady level of the drug in your body. You can take it with or without food, but if it upsets your stomach, taking it with a meal can help. However, there's a very important rule here. Avoid taking ciprofloxacin with dairy products like milk, yogurt, or cheese, or with calcium-fortified juices on their own. Why calcium can bind to the drug and prevent your body from absorbing it fully, making it less effective. If you want to have dairy, make sure you do it at least 2 hours before or 6 hours after you take your ciprofloxacin dose. The same goes for antacids and supplements containing iron, zinc, or magnesium. Spacing them out is key. Also, it's really important to drink plenty of fluids and stay well hydrated while you're on this medication. This helps your kidneys function well and can prevent certain side effects. And the golden rule of all antibiotics: you must finish the entire course prescribed by your doctor, even if you start feeling better after a few days. Stopping early can lead to the infection coming back, and even worse. It can contribute to the development of antibiotic-resistant bacteria, which is a huge global health problem. So, see it through to the end. Like any medication, ciprofloxacin can have side effects. Most people tolerate it well, but it's good to be aware of what could happen. The most common side effects are usually mild and can include nausea, diarrhea, dizziness, or a headache. These often go away on their own as your body adjusts to the medication. However, there are some more serious, though much rarer, side effects that you need to watch out for. One is tendinitis, which is inflammation of a tendon, or even a tendon rupture. The risk is highest in the Achilles tendon at the back of your ankle. If you experience any sudden pain, swelling, or stiffness in a joint or muscle, especially your ankle, stop taking the medication and call your doctor immediately. This risk is slightly higher for people over 60, those taking steroid medications, or those who have had a kidney, heart, or lung transplant. Another thing to be aware of is sensitivity to sunlight. Ciprofloxacin can make your skin much more sensitive to the sun, leading to severe sunburn. While you're taking it, and for a few days after, it's wise to avoid prolonged sun exposure. If you have to be outside, wear protective clothing, a hat, and use a broad-spectrum sunscreen. In rare cases, it can also affect your mood or mental state. causing things like confusion or anxiety. And very rarely, it can cause nerve problems, like tingling or numbness in your hands or feet. If you notice any of these more serious symptoms, don't wait. Contact your healthcare provider right away. They can assess the situation and decide if you need to switch to a different antibiotic. Always remember, your doctor prescribed this medication because they believe the benefits of fighting your infection outweigh the potential risks. Before you start taking ciprofloxacin, it's crucial to have an open conversation with your doctor about your health history and any other medications you retaking. This includes over-the-counter drugs, vitamins, and herbal supplements. Why? Because ciprofloxacin can interact with other substances. For example, it can increase the effects of blood thinners like warfarin, raising the risk of bleeding. It can also interact with certain diabetes medications, potentially affecting your blood sugar levels. If you take theophylline for asthma, ciprofloxacin can raise its levels in your body, increasing the risk of side effects. And, as we mentioned earlier, anticides and supplements with minerals like calcium, iron, and zinc can interfere with its absorption. You should also tell your doctor if you have a history of certain health conditions. This includes kidney problems, a history of seizures, heart conditions like an irregular heartbeat, or a personal or family history of an aortic aneurysm. It's also important to let them know if you have myasthenia gravis, a muscle weakness disorder, as fluoroquinolones can make the symptoms worse. Being completely transparent with your doctor ensures they can make the safest and most effective choice for your treatment. So, let's quickly recap the key takeaways. Ciprofloxacin is a powerful antibiotic used for serious bacterial infections. It works by stopping bacteria from replicating. Always take it exactly as prescribed by your doctor and finish the entire course. Be mindful of taking it separately from dairy, antacids, and certain mineral supplements. Stay hydrated and protect your skin from the sun. Be aware of potential side effects, from common mild ones to the rare but serious ones like tendon pain. If you experience anything concerning, especially sudden joint pain, contact your doctor immediately. And always, always, discuss your full medical history and current medications with your healthcare provider before starting treatment. Communication is your best tool for staying safe. The world of antibiotics is fascinating and so important for modern medicine. Using them wisely helps ensure they'll continue to be effective for generations to come. Thank you so much for joining me today to learn more about. I hope this video was helpful and cleared up some of your questions. If you found this information valuable, please give this video a thumbs up and consider subscribing to the channel for more clear and reliable health content. Don't forget to hit that notification bell so you won't miss our next video. Stay safe, stay informed, and we'll see you in the next one.